Hi, my name is Miguel, and in this video, I will be conducting a full body assessment to evaluate range of motion stability and overall movement efficiency. Based on the results from the assessments, I will identify limitations, asymmetries, and then implement a corrective exercise program consisting of both dynamic and static exercises to improve mobility, stability, and overall movement quality. Moving on to the assessment section, we will start off with the lower body. This will consist of the ankle dorsiflexion, hamstrings, hip flexors, and the Y balance assessment. The first assessment will be the ankle dorsiflexion of the knee extended to evaluate the gastrocnemius. The participant will perform a forward lunge while keeping heels flat on the floor and keep the knee moving forward over the foot. An inclinometer will be placed along the tibia to measure dorsiflexion angle. I will be observing for maximum range of motion. Next, we will be moving on to the ankle dorsiflexion of the soleus. The participant will perform a lunge with the knee bent while keeping the heel in contact with the floor, flat on the floor. The inclinometer will be placed along the tibia to measure dorsiflexion. I will be observing the maximal range of motion, making sure that the heel remains flat on the floor, and making sure that the participant's movements are controlled. Next, we will be moving on to the ankle dorsiflexion of the soleus. The participant will perform a lunge with the knee bent while keeping the heel in contact with the floor, flat on the floor. The inclinometer will be placed along the tibia to measure dorsiflexion. I will be observing the maximal range of motion, making sure that the heel remains flat on the floor, and making sure that the participant's movements are controlled. Next is the lower quarter stability test, also known as the Y balance test. This assessment is used to evaluate balance, neuromuscular control, and stability of the lower body. The participant begins standing on one leg while maintaining an upright posture. The hands placed by the hips to minimize upper body compensation. From this position, the participant reaches with the leg opposite in three directions: anterior, posteromedial, and posterolateral, lightly tapping the ground before returning to that starting position under control. During this movement, I am observing the participant's abilities to maintain proper balance, proper alignment of the stance leg, and control throughout the reach. Next, we will move on to the active straight leg raise to assess hamstring flexibility. This assessment will evaluate hamstring mobility and flexibility. The participant will start laying down on the floor in a supine position. Next, we will have the participant keep one leg extended on the floor while the other leg is raised with the knee kept straight. The inclinometer will be placed along the tibia to measure hip flexion angle. I will be observing the maximum height of the leg, making sure the pelvis remains stable and the opposite leg stays in contact with the floor. Next is the active knee extension, or the AKE test. This assessment is used to evaluate hamstring flexibility, specifically at the knee joint. The participant starts by lying in the supine position while one hip is flexed to approximately 90 degrees. The thigh is stabilized in this position to prevent movement at the hip. From here, the participant actively extends the knee as far as possible while maintaining the hip at 90 degrees of flexion. During this movement, I am observing the amount of knee extension achieved, as well as any compensatory movements from the hip and pelvis. In this case, the participant demonstrates limited knee extension, indicating decreased hamstring flexibility. Next, we will move on to perform the modified Thomas test to evaluate hip flexibility of the rectus femoris. The participant will start at the edge of a platform, bringing both knees up as they did with the bilateral hip and knee flexion assessment. The participant will lie at the edge of the table while holding one knee towards their chest to stabilize the pelvis. Then the testing leg will come out, hanging freely while the inclinometer is placed to get the degree measurement. While the participant is performing this assessment, I will be observing the position of the thigh and knee and ensuring that the pelvis remains neutral. Lastly, we will assess the Iliopsoas using the modified Thomas test. This variation of the modified Thomas test will evaluate Iliopsoas flexibility and range of motion. The participant will lie down at the edge of the table, holding both knees towards the chest to stabilize the pelvis. Next, the participant will maintain one hip in flexion towards the chest, while the opposite leg, the participant will actively flex the quadriceps while slowly lowering the leg, keeping the knee completely straight, making sure the pelvis remains in a neutral position. The inclinometer will be placed along the thigh to measure hip extension. I am observing whether the thigh remains level with the table, while also monitoring for any compensation or deviations, such as arching or pelvic movement. Next, we will move on to the trunk, and this will consist of trunk flexion and trunk extension assessments. The seated trunk flexion assessment is used to evaluate trunk mobility and posterior chain flexibility. The participant begins seated upright with knees flexed and then flexes forward under control. During this movement, I am observing trunk range of motion and any compensations. In this case, the participant demonstrates adequate forward reach, but however, excessive spinal rounding is observed. This indicates that the movement is being achieved through the spine rather than controlled trunk flexion. Next is the trunk extension assessment. This test is used to evaluate spinal extension, mobility, and flexibility of the anterior chain. The participant begins by lying in the prone with hands positioned under their shoulders. From this position, they press through the arms to extend the trunk while keeping the pelvis in contact with the floor. During this movement, I am observing the amount of extension achieved and whether the pelvis remains in contact with the ground. I am also looking for any compensations, such as hips lifting off the floor, uneven extension, or excessive reliance of the arms. Lastly, on the assessment section, we will assess the upper body, which consists of the Apley's back scratch test and the upper Y balance test. This is the Apley's back scratch test. This assessment is used to evaluate shoulder mobility. The participant begins in a standing position. One arm reaches overhead and down the back, while the opposite arm reaches behind and up the spine. I'm tending to bring the hands as close together as possible. The test is then repeated on the opposite side to compare bilateral shoulder mobility. During this movement, I'm observing the distance between the hands, side-to-side differences, and any compensations such as trunk flexion, excessive neck movement, or shoulder elevation. Ideally, the participant should be able to bring the hands close together or touch without any compensatory movements. In this case, the participant demonstrates a notable gap between hands and slight asymmetries between sides, indicating limited shoulder mobility. Next is the upper quarter Y balance test. This assessment is used to evaluate upper body stability, mobility, and neuromuscular control. The participant begins in a push-up position with the feet shoulder width apart and one hand placed firmly on the ground. The opposite hand is used to reach in different directions while maintaining balance. From this position, the participant reaches with the free hand in 3 directions: medial, infralateral, and superolateral, lightly tapping the ground before returning to the starting position. During this movement, I am observing the participant's ability to maintain stability through the supporting arm, proper trunk alignment, and control throughout each reach. I am also looking for any compensations, such as trunk rotation, loss of balance, and shifting of the hips. In this case, the participant demonstrates mild instability and trunk rotation reaching, indicating reduced proper quarter stability and core control. Next, we will move on to our corrective exercises, starting with the walking lunge. Up next is a deep squat. This exercise targets the ankles and hips to help improve dorsiflexion and overall lower body mobility. To perform it, descend into a deep squat while keeping your feet flat and your heels firmly on the ground. Next up is the bear dog. This move is all about core stability and coordination. Apley want to build a better trunk control and balance. So starting off with our hands and knees, we'll slowly extend one arm and the opposite leg simultaneously. Focus on keeping your hips level and your spine neutral throughout the movement. Next are glute bridges. This exercise will target glutes and the posterior chain. This is going to help us improve trunk stability and hip extension. To perform it, we lie in a supinated position, pushing through our heels and lift off with the hips while squeezing those glutes. Next, we'll be moving on to the world's greatest stretch. It targets the hips, hamstrings, and spine. This exercise will help us improve our hip and trunk mobility. The combination of multiple movements will help improve flexibility. To perform it, we step out into a lunge, bring one elbow to the ground, and rotate the opposite arm upward. Next are leg swings. This exercise is going to help target the hip flexors and the hamstrings. This will help improve overall hip mobility and will correlate to the modified Thomas test. Leg swings will help us increase range of motion in the hips. To perform it, we will swing one leg forward and backward in a controlled manner with no torso movement. Next is a knee hip flexor stretch. This exercise targets the Iliopsoas to improve mobility and performance in the modified Thomas test. Because tight hip flexors often restrict hip extension, we use this movement to restore range of motion. To perform it, we'll kneel on one knee, tuck in the pelvis, and then gently drive the hips forward. Next, we'll move on to the child's pose. This stretch targets the trunk and lower back to enhance mobility and spinal flexibility. We'll start on our hands and knees, slowly shifting the weight back until our glutes rest on our heels. Reach your arms forward, lengthening through the spine, and relax your forehead toward the floor. Hold this position, focus on deep, controlled breathing. Next is a standing quad stretch, which is going to target the rectus femoris. Since tight quadriceps can limit hip extension, a key factor in the modified Thomas test, this exercise will help with mobility. To perform it, we stand upright with the knees together. We'll pull one ankle toward the glute while maintaining a neutral spine and keeping your knees aligned. Our last static exercise will be the wall calf stretch. This exercise targets both the gastrocnemius and the soleus. Both are essential for improving ankle dorsiflexion. To perform it, place both hands against the wall, step 1 foot back while keeping the heels firmly planted, and lean into the wall to feel the stretch.